And what we wanted to bring to your attention, and then you've probably been hearing on the news the way things are shifting in the NHS because it's under a lot of pressure and a lot of pressure on people going into hospital, people taking up beds for quite a long time because it's hard for them to be discharged. There's a lot of shifts now of looking more at prevention. Um, and certainly diabetes is one of the areas that we'd like to focus on. And what we're doing in Sutton is we're working together. It's kind of a newish concept, but think of it as a neighborhood team. So we've got a Carshalton neighborhood team called Integrated Neighborhood Teams, where all system partners come together. So you have social workers, pharmacists, NHS people, community services, volunteers, people like yourselves, where we all can work together so that we can meet the needs of your community. And what we'd like to do today is Bhavna will talk to you a little bit more about some of the priorities that we're working in Carshalton integrated neighborhood teams. Then we'll pass on to Reena, who's our pharmacist, to talk us through the diabetes and smoking cessation. But it would be great we have a bit of time to discuss the in person and what kind of events you would find beneficial because we could be doing health talks, we could do blood pressure checks, we could be talking about physical activity. I want to make sure this forum is beneficial to you. It's not the other way around. We're not coming with our own agenda. So can I hand you over to Bhavna?
Hello, thanks Nadine, thanks for handing over, and thank you Sidi for inviting me in as well today. So my name is Bhawna Brijwani, and I am one of the four senior primary care and community delivery and development manager in the Integrated Care Board. So I don't know if you're familiar with the Integrated Care Boards. Originally, they used to be CCGs, the clinical commissioning groups. They were just there's more of an approach now with the integrated care board. That's sort of the new name for it, just to kind of have more a development approach for the community and the primary care. I am one of the four managers, as I said, and we are four because in Sutton we've got four different sort of PC primary care networks, so PCN. So we're divided into Sutton, Wallington, South and Central Sutton, and sort of Cheam area. I am primarily working for Carshalton. The reason why I've come up to speak to you all today is because as Nadine explained, along the long-term NHS plan, and to kind of make sure we are being more proactive in terms of care rather than reactive, and shifting the care to community, we are having more of a cardiovascular disease focus because apparently 1 in 3 people have cardiovascular disease. And we have, in terms of Carshalton, how do we target that? We've noticed in Carshalton, there are a lot of people with diabetes, and that's one of the risk factors for cardiovascular disease. So that's why that's kind of coming on to now onto Carshalton priorities. So as an integrated neighborhood team, which means combining a team of GPs, local community teams, from NHS, and our lovely pharmacist, Reena, will kind of talk about more in detail about one of our priorities. But like having all the teams together, coming together to form an integrated team, that we have certain priorities specifically for Carshalton. One of them being we're trying to address smoking cessation in the diabetics. In this priority, with all the partners, as in the stakeholders, including the primary care networks, pharmacists, GPs, public health colleagues, have come together to work on this priority to identify who the diabetic smokers are and how we can reach them, and we can create some form of events where there could be some form of education or which Reena will talk about in detail, so I won't touch on there. But there's other priorities like smoking cessation in the housebound as well. So similar sort of stakeholders are involved in there, and how do we reach out to the people who actually can't get out, can't get to these events happening? So trying to target that as well to see how we can educate them more and how we can improve on reducing that risk factor. And there are other priorities as well in Carshalton, aligning with well-being in children and young people, but I'm not going to go into too much detail about that as of yet, just because we're focusing here on diabetes. So I will now hand over to Reena, and if you have any questions, we'll take it right at the end after Reena's finished, probably.
Thank you, Nadine. Thank you, Bhawna. Thanks for having me, everyone. Really nice to meet you all. My name's Reena. I'm a local community pharmacist based in Carshalton, Sutton border on Erskine Road. And it's kind of interesting because normally I come and talk about medicine to people. But today I'm talking about smoking cessation, which is actually a really interesting topic, and in particular with people who have diabetes. And it's very interesting because I always say to people that I have a pharmacy full of medicines that can heal everybody. But actually, the most single thing that I can do to help people is to help people give up smoking. All those medicines in my pharmacy probably won't do as much good as if people give up smoking, because smoking is one of the largest preventable causes of death in the UK. And when we're talking about risk factors, and there are sort of several types of risk factors, and smoking is one of those risk factors that we call modifiable, because it's something you can do something about, just like exercise, diet, and you can modify this. You can stop smoking, you can change your diet, you can change your exercise. There are other risk factors for disease, such as genetics and things which you have no control over. But smoking, diet, exercise, these are all modifiable risk factors. And in particular, I was looking up some data on diabetes in particular and smoking. And actually, recent scientific studies have shown that people who smoke cigarettes are 30 to 40% more likely to develop type 2 diabetes than non-smokers. So we've got a real issue here that we have in Carshalton, 1 in 5 adults are a smoker, which is a huge statistic. And actually, nationally, across the country, we're seeing a decline in smoking, mainly because people have understood how bad it is for your health. It's actually very expensive to smoke. I was looking up how much a packet of cigarettes is, and a packet of Benson and Hedges, pack of 20 is £16.50. If you smoke a pack a day, 20 a day, that's about £6,000 a year that you're spending on smoking. And if you smoke for 10 years, that's £60,000 that you'd spent on cigarettes. And I always say to people when I'm helping them to give up smoking, if I gave you £60,000 in cash, would you ever burn it? And they all say, no, of course not. Well, that's what you're doing when you're smoking cigarettes. There's a really interesting kind of psychology, isn't there, to smoking and the way people kind of think about it and don't think about the money. There's actually a really clear dose response relationship too. So the more you smoke, or the earlier you started smoking, the higher your risk of diabetes as well. So what we're trying to do in conjunction with London Borough Sutton and just generally the government as well is try to create a smoke-free generation, where it's going to get harder and harder for young people to buy cigarettes because the age limit is going to be increased over the next few decades. And hopefully in 20, 30, 40 years' time, we'll have a whole generation that never started smoking, which is the absolute aim, obviously, for all of us. So I wanted to kind of just touch on the smoking and the diabetes a little bit, because I think it's interesting to understand why smoking is bad, in particular for diabetics. So just want to raise your hand if you are a smoker. Any of you want to admit to it? Anybody in the room a smoker? Raise the virtual hand. No? There's one. Okay, Abu. Yeah, fair enough.
I am an ex-smoker. I stopped about 43 years. Yeah, I stopped about 43 years ago. But
amazing.
I just want to pick on the point what you said about if you give me £60,000, I would take the £60,000. It doesn't work that way.
It doesn't, because all smokers tell me they find the money.
I've stopped for 43 years. I can't see the money that I'm not smoking. So with that issue, I mean, if we tell people you're going to save money, it's not, because they will not see the money.
No, and most smokers say to me, we somehow find the money. And so one of the tactics I say to people when they're giving up is to put £10 in a jar every day, because even if you smoked half a pack of cigarettes, or cost of cigarettes back in the day, even if you put £10 in a jar at the end of the week, that's £70, isn't it? That £70 is a nice takeaway. It's a meal out, maybe if there's two of you. It's interesting where you can put that £70, because if you keep it aside, you do see the money. And that's the kind of trick, to have a motivational kind of element of smoking, of giving up smoking in particular. And I think there was another hand that went up. So maybe we have one smoker. But the idea of me telling you about this is, obviously, if you're within this group, you'll know other people who maybe have diabetes, or other colleagues or friends or family or relatives that do, or you may know some smokers. And it's really important that people understand the harm that smoking does to your body. So obviously, within cigarettes, you have nicotine. And nicotine is the addictive component of smoking. So that's what makes you have a cigarette after cigarette after cigarette. But actually, nicotine in itself is not actually harmful. What it is, it's addictive. And that's what makes you have that cigarette after cigarette after cigarette. What is harmful in cigarettes is all those other chemicals that you breathe in when you burn the cigarette. And those actually are ones that kind of lead to the problems that can cause diabetes. So the chemicals in those cigarettes can lead to inflammation. And we know how inflammation is linked to diabetes. It can link to oxidative stress, which is kind of a real trigger in combination with inflammation to help make people sort of promote sort of the sort of damage to the body that can lead to diabetes in particular. And actually, if you're a smoker, it can actually affect your levels, how your levels of insulin are regulated. So some people who smoke quite a lot of cigarettes often need more insulin to control their diabetes as well. And there's lots of evidence to say that. But actually, one of the most worrying things, which is what's important about trying to get diabetics to stop smoking, is that smoking and smokers are at greater risk of complications with diabetes, because smoking is an additional risk factor as well as diabetes to some of those big complications such as kidney disease, nerve damage, even some evidence around retinopathy, so damage to your eyes. And that's why we're really trying to encourage people to give up smoking. So what we've been doing locally in Carshalton in conjunction with the integrated neighbourhood team is reaching out to diabetics who are smokers via GPs. So normally the GPs will have a record if you're a diabetic, and they'll have a record if you're a smoker. So what we've been doing is texting out to all these patients across Carshalton who are registered with GP practices, who are registered as diabetics and smokers. And we've been offering some group consultations. We've been basing them at Rythe Green Surgery, which is on Rythe Lane, but we're actually going to be doing a couple more, one at Brijwani House Surgery and one at Riverside, which is on Culvers Avenue. I think it's Culvers Avenue in Carshalton, just as a kind of outreach. And the idea of these is you come along to the session, or smokers come along to the session, and I run a one-to-one kind of group consultation with them all face to face. And we go through the various reasons people might want to give up. So some of the most common reasons people want to give up smoking is money, health, been told to do it, and I've been running some of these consultations, and a lot of people say to me, I had a lady last week, actually, she broke my heart, saying she smoked for so many years and her child won't let her see her grandchildren anymore because she's a smoker, and they don't want her to be near her grandchildren. And that's why she came to give up, because she really wants to see her grandchildren. There was another lady whose dad died in a house fire because he was a smoker, fell asleep with cigarettes, and it really scared her. So she wants to give up smoking. So lots of reasons that people want to give up smoking. And it's important to identify those reasons. And even though people want to give up smoking, they might not actually go and do it. It's actually really hard to give up smoking. It's a habit that people have formed over years and years and years. People have smoked and they kind of have a kind of sort of daily routine around smoking as well. So it can be really hard, which is why we go in and we talk to them about our local services that are available to smokers. So there are several pharmacies across Sutton and Carshalton that offer a stop smoking service. This is a service that's funded by the London Borough of Sutton. And what it entails is that you meet a pharmacist every week for 4 to 6 weeks. That pharmacist is not only a pharmacist, but they're a specialist in helping people give up smoking. So we've all done specialist training to help people give up smoking. And what we do is we go through the various different ways that you can give up. So some people can just give up like that, cold turkey, with no problems at all. Some people need some help, and we're able to offer nicotine replacement therapy, which is basically what it says on the tin. It replaces the nicotine that you'd normally get from smoking in the form of a patch, chewing gum, lozenge, spray. And what that does is help people with their level of addiction. Like I said to you at the beginning, smoking, the nicotine is not actually harmful, it's addictive. So if we can replace the addictive component with something that's clean in the form of a patch of nicotine or a gum, then actually it's probably okay to be addicted to nicotine patches for the rest of your life, because they're not harmful. They don't have all the other chemicals that cigarette smoking gives you when you smoke. And so you wouldn't have all the complications that I mentioned about the nerve damage, kidney damage, damage to your eyes, and obviously increasing your risk of developing diabetes if you were just using pure nicotine. And eventually we want to help people come off that nicotine as well. The program lasts for 4 to 6 weeks because we know it can take 4 to 6 weeks to undo a habit. And going to see a healthcare professional actually doubles your chances of giving up successfully when they've done lots of studies in people who go to see a healthcare professional. But also using products like nicotine replacement also doubles your success of giving up smoking, which is why this service is really, really good. It's free. And most pharmacies are really accessible, are open 6 days a week, open long hours. So you can always go to a pharmacy that can offer this service. And if you're a diabetic, you don't usually pay for your prescriptions. You'd actually get the nicotine replacement therapy free as well on the NHS. So it's basically a win-win situation. And what we find is that some people come to us and they can give up just like that. They use a nicotine replacement, do 6 to 8 weeks, and given up, and they're absolutely brilliant. And then usually what happens is sometimes some people stay a non-smoker for life. Some people may go back to smoking. So our door is always open to help people give up smoking. It's not one of those things that I tried it once, couldn't give up, so I'm going to just continue smoking. We always say don't quit at quitting. Always try give up smoking because it is the best thing you can do for your health. And I think hopefully what we'll be able to do is share with City a flyer that we've got, which is a map of Sutton and Carshalton, which shows all the various pharmacies that offer this service. We'd really like you to promote this service to your group, obviously. And if any of you are thinking about giving up smoking or know people who would benefit from it, then we'd really appreciate if you'd refer them to the service, because I think it could really help them. I'll stop there and I'll kind of open up for questions, but I will just quickly mention something that City wanted me to talk about, which was about physical activity. So you know how I talked about smoking being one of those modifiable risk factors for disease, in particular diabetes? Well, physical activity is the same. It's one of those risk factors that if we're not active, we can obviously increase our risk of type 2 diabetes, cardiovascular disease, and a whole other load of conditions, including cancers as well, with obesity being one of the largest causes of cancer in particular. So I think City just wanted me to give you a bit of an overview of physical activity. And I never like to say the government sets guidelines on what's good for you, but there are some guidelines on what's good for you in terms of physical activity. And actually, we should all be doing 5 lots of 30 minutes of some form of exercise that we call moderate intensity a week. That's 150 minutes. And I break that down into 5 days, doing 30 minutes of moderate intensity exercise. And what that means, moderate intensity exercise is exercise where you feel slightly warm, slightly sweaty. You want to take a layer off maybe while you're doing it, and you feel slightly out of breath, not so much that you can't finish a sentence. But when you're doing exercise to that level, that's when you're burning calories, and that's when you see the benefits to your health. Loads of people say to me, oh, I walk the dog every day, and I watch them walk the dog, and they're really doing it nice and gently, slowly, where everyone says, oh yeah, I do my 10,000 steps, but everybody does it really slowly, and nobody's doing exercise to moderate intensity. So if there's one thing you take away from today, is that word moderate intensity. So when you do exercise, you should feel slightly warm, want to take a layer off, slightly out of breath, and that's when you're burning calories, and that's when that exercise is having a beneficial effect to your body. But actually, it's also about the type of exercise you do. So don't just do walking, because we know that walking is good for you and that's aerobic. But actually, there's lots of evidence to say we should be doing resistance training, whether that's using free weights in a gym or just in your kitchen, just lifting cans of baked beans, or using those elastic bands that you can get to help to produce resistance. There's lots of evidence to say we should be doing flexibility exercises, so things like yoga, Tai Chi, stretching, because that really helps our muscles and our ligaments and things to stay flexible, but also balance exercises, because balance is really, really important. And as we get older and we don't maintain our muscle mass, and we don't do exercise, we can lose our balance. And then as we get older, we can be at risk of falls. And we all know how dangerous falls can be in terms of risk of fracture and lots of sort of things that can happen to people when they do fall. So I could spend hours talking about all the modifiable risk factors, because you've got diet, you've got smoking, you've got exercise, but hopefully I've just given you a bit of a summary into the few things that I think are hopefully some take-home messages about giving up smoking if you're a smoker, and just trying to increase your moderate intensity exercise to be kind of 5 lots of 30 minutes a week, because those sort of things are actually really, really important. In particular in diabetes, there's also evidence that if you lose weight, do exercise, give up smoking, your diabetes is better controlled. So you can actually maybe come off medication, lower your insulin that you're using in particular as well. So there's lots of benefits of all of these things. And then obviously if we improve the diabetes, reduce your risk of those long-term complications of nerve damage, and kidney damage and eye damage and all those risk factors towards heart disease and stroke that we worry about as well. So I'll stop there, and I'm happy to answer any questions, as will Nadine and Bhawna as well, I'm sure.
Thank you, Reena. Any questions or comments from anyone? Abu?